one thing, some people have asked the question because they've seen that you're doing some studies. You're looking to see the nature of the pollution, to see what kind of pollution, so they know what method to use. But wasn't that what was done by UNEP in the first place? Are we not repeating what was already done? Why repeat what they've done?
No, that's not what is done. The process of remediation it's a process, not an isolated activity.
Yeah.
So it starts with first answering the question, yes or no, is this place contaminated?
We see that it is contaminated.
Yeah, that is the primary reason. It's just like, are you feeling well or you're feeling unwell? You could just tell somebody is not feeling well by looking at them. Okay, but do you know what exactly is wrong with this person? No, you will need a physician to then look at this person, examine the person, and tell whether it's the liver, the kidney, or whatever part of the body that is. Then when you find that part of the body, you look for the expert that knows how to fix that. So that is this procedure. So UNEP answered the first question. Are you looking sick? Yes, he's sick. So what do we do next? We have come to now look at the diagnosis. It's a process we call characterization to now identify those contaminants and the best way to get rid of it.
So, Dr. Tekil, so far, if I were to go there to see what has happened in the OGONI land, since you've been working, what will I be able to see? What will an average person see? So, oh my gosh, they've done such and such.
Well, a lot has been done in course of the establishment of the Project Coordination Office. 2018 were the silent period when we're carrying out the assessment and characterization delineation of the sites. 2019, we introduced the companies to the site, and work has started at different locations. 21 sites in all the local government. I could give you the names of all the sites and the work that is going on. But basically what has happened is that we mobilize contractors to site. The contractors are at different stages at different locations. Most of them are within the first 30%. Some have progressed beyond the first 30% of the total completion activities that need to be carried out. Then over this period too, we have trained a whole lot of our scientists, the young people we sent to Geneva, and people we trained within high prep in Nigeria, and those we also trained in-house. We've also carried out livelihood training. We've done some collaboration with IITA and the SDN, and we've got some people. We also have facilities that we're developing. We've gone into alliance with UNITA and the River State Sustainable Development Agency.
UNITA, that's the United Nations Training and Research. Okay. So what do they really do?
They are training these women because we have tasked them, we've given them the assignment to train these women. And we will be aligning with all that training to other trainers in other ways. But the important thing about this training is that we emphasize on post-training, so that when these women finish from the training, they don't go back home. They're given startup packages that people buy of them.
You've also done something in health. What I heard you
exactly. We had the World Health Organizations. I mean, working with UNEP, they've been to OGONI land, collaborating with the River State Ministry of Health, and we have gone to do an assessment of the facilities and the personnel in these locations, so as to prepare for the study, the health study. It is one of the major things we're going to be doing this year. So in 2020, there's a whole lot that we've planned. We're adding
that health is for what? To check
health is a health study. The health study is part of the recommendations of the report. The report says that we have to see if there is a relationship between these diseases in these communities and oil pollution, and that's what this health study is going to do. Well, we're going beyond
and if there is?
That's exactly what I'm saying. We're going beyond what is recommended to also provide some facilities. We've done some health intervention, some health outreach twice in course of this program, where we have carried out about 400 surgeries, different range of surgeries with OGONI doctors, indigenous doctors in OGONIs, as well as some women doctors. Over 70 doctors will deploy to the 4 LGS. And we've also attended to over 20,000 patients during this period. We've used the period to also
20,000 patients.
Exactly. We did it LGA by LGA of 2 centers per LGA, attending over a week.
And when they find out that there's a problem, what these guys have gone, when they finish this,
that's exactly what we're doing. We went there with medications. We did the things that we needed to do by the way of a medical outreach. We referred people to experts, those that needed continuation. We also took care of bills of people who were in the hospital.
That's what I'm saying. But that's why I found out that there is a problem that I got to deal with. but the people who did the thing have left.
That's what I'm saying. There's
So
a continuation.
who pays for me?
We have been. This is what we did. We did this in collaboration with the River State Ministry of Health, which means we use the traditional hospitals in the localities.
Yeah.
So in Gokana, we use the Terabo General Hospital. That's where we did this. So where cases that needed attention, they go back to the doctors there to follow through. We're paying for it. In Bori, we did the same thing. The hospital in Bori took care of this. There are things that needed to follow up. We dealt with the doctors and the hospital there. We did same in Tamba. We did the same in the Noah and in Pite. And in Eleme, we did in 2 locations, in the Ogale General Hospital as well as in One. So this is it's something we did beyond what is recommended.
Most people may not realize this, but I mean, your job, what you're doing is extraordinary, truly extraordinary. And it's supposed to is not just for Ogoni. It's supposed to be for the whole of, eventually for the whole of the Niger Delta. Am I right?
Yeah. The good thing here is that what we're doing now, we are developing this template.
Transit to
exactly. That's the next question. So what we are doing, we are developing the template that will be used across. So exactly what we're doing in Ogoni, we build it as a standard.
Yes.
So when we move to the new other locations in the region, we are replicating the same thing with room for improvement, of course.
How can you cause people in other parts of the country to really appreciate what you're doing, to not say, okay, there's just an Ogoni thing? How can they see how they're connected with it?
The connection, like I said, is that for everything, you need to start from somewhere. You need to start from on a very high standard. Yeah. We have this, that the United Nations are giving us the standard, and they're helping us build that template that will be used. So that we have a very high level quality template is what is of benefit to the whole nation.
Okay. Now, the way I sort of see it, I see the need for good, strong global partnerships, and I'm just wondering, do you have any plans for getting? I often suggest to people to look at a tripod consisting of government as policy and civil society, academia, and business. And that you, whatever it is, we need to work with these 3 groups of people at all times for sustainability. I'm not sure how much you're using the universities in the area for some of your tests, for your training, for whatever, but I'm thinking that maybe there's a role there. Then also perhaps there's a role for business people, not just from the area, but from across Nigeria and perhaps across the world. You know, I think what you're doing, like I said, I think it's so extraordinary that I'm not sure if you have plans for getting investors and people from other parts of the world to come. Okay, Ogoni is clean now, it's getting clean. We need a golf course. We need this. People are excited. People are ready to do business. I'm looking at a bigger picture. Perhaps you're doing it already. If you can tell us a little bit about that, if you have anything like that in mind.
What it is that the cleanup, like I said, this is a technical activity. And there are the developmental aspect of it. Okay. But even within the technical activity, we have a restoration period where we're going to be doing the regeneration of the vegetation as well as the aquatic and terrestrial life of the environment. But the key thing is that collaboration. From the assessment done by UNEP, we started collaborating with the universities. Okay. The collaboration, and during the assessment, we collaborated with the River State University in the assessment phase. This phase again, too, we are going to be collaborating with the same universities, the University of Port Harcourt as well. And the health study, for example, we are having to work with the University of Port Harcourt Teaching Hospital and even the River State University Teaching Hospital that we've just been established. So the health records of the people that have used these facilities over this period, we will need them. And so we need to collaborate with the university that has been working and been treating this over this period. And as well as international organizations, we were looking at working with the Harvard Institute and all of those international organizations. Of course, the health study is driven by the World Health Organization, and you couldn't talk of a stronger partner than the WHO when it comes to health matters globally. So we are dealing with the best that we can access internationally.
Do people look at you as a APC organization because it was launched by President Buhari? Are you a high prep? Are you an APC high prep?
Well, what it is that what I'm doing is a highly technical work.
Yeah.
I was fortunate to be part of the scientists that did the UNEP report, part of the UNEP scientists. So we're doing a highly technical work that requires technical expertise. That's what I'm delivering to this project.
How do people see you?
They see me as an expert who's doing my job.
On that note, Dr. Dekio.
Thank you.
Wonderful.
Thank you, sir.
Fantastic.
Thank
Good
you.
job.
Bye.